Okay, well, welcome everyone. We're going to go ahead and get started. I want to be respectful of everyone's time. And we intend to save as much time in the second half of this call for Q&A. So please enter your questions using the Q&A feature at the bottom of your menu toolbar, or you can post them in the chat. We will likely not be able to get to everyone, but we'll do our level best. Participants will be muted during this discussion, so please make sure you're on mute. And welcome. Thank you all so much for being here on such short notice. I'm Melissa Ellis, Director of Operations at the Association of Programs for Rural Independent Living, or APRIL. I use she, her pronouns. And I'd like to give you just a little background on who we are and how we got here. Back in May of 2020, APRIL was contacted about convening national calls to address COVID-19 in congregate settings and to share resources to facilitate a swift response to evacuate people with disabilities living in those facilities. We knew very early on that COVID would ravage people living in congregate settings. APRIL didn't hesitate to answer this call to action. About a week later, a diverse group of advocates began meeting weekly to put together plans to address this need. Saving Institutional Lives via Emergency Relocation, Silver, was formed, bringing together amazing advocates such as Fran Tobin from Institutional Rescue and Recovery Coalition in Chicago, Peter Gross, Tom Olin, Barb Pritchard, Ebony Payne, and many other folks who have joined over the last year and a half to do the work that so desperately needs to be done. You will hear from some of those key advocates today. Most of the groups involved in this advocacy have many years of practical experience and expertise in transitioning people out of nursing homes and other facilities into non-congregate settings. The media reports and the government responses still to this day remain long on sorrow and short on solutions, demonstrating what many advocates see as a combination of systemic ableism, a lack of vision, and a flat out indifference to the disability community. Back in July of this year, we held a webinar which was attended by pretty much every federal agency with a role to play in this response, and we remain thankful for their participation. As we pass the 18-month mark of this pandemic, we are still waiting for the lives of people with disabilities to be valued and prioritized. We see a tremendous lag in the vaccination status of the people who work in congregate facilities, which further endangers people with disabilities who are trapped there. Until congregate settings are no longer the go-to place to warehouse people with disabilities, we will continue our grassroots actions. Our hope for today is that we lay out a path forward, albeit full of barriers and hoops to jump through, but a path nonetheless. We fully intend to continue to pressure the federal agencies whose job it is to make these transitions happen. We will continue the work. We will continue to convene these kinds of calls in order to provide a space to share best practices, resources, troubleshooting, and creative ways to continue this imperative work. And with that, I would like to introduce our first speaker, Andres Gallegos from the National Council on Disabilities.
Alyssa, thank you. And I just want to thank April for having me and also for the work that you've done during the pandemic. It's, the Centers for Independent Living have a critical role to play in these particular issues, and I believe are best suited to assist the disability community in their locale. to transition out of the congregate settings into non-congregate settings and keep them safe during the pandemic. To let you know that the National Council on Disability, we are having a meeting with FEMA, with HHS, and other groups on Friday to discuss this particular issue to ensure that there is adequate funding that is provided for Centers for Independent Living to do this kind of work, but not just in the immediacy of the crisis where we find ourselves, but to put in place a plan, a longer term plan that's going to be sustainable, one that's not based on a reimbursement model, but direct appropriations for Centers for Independent Living to transition people out of congregate settings as the pandemic continues, but also for future either public health emergencies or national disasters. So I just wanted to say those few words, and again to express my gratitude for the work that April's doing and all of you who are on this call are doing as well. I know it's been a difficult 18, 19 months, but let's see if we can get some answers out of the government, specifically in how they're going to immediately address this issue to ensure that Misty's Center for Independent Living is not the only one that's getting reimbursement for these services, but again, also put it in plan and start having conversations for the long term and what sustainable model is best to put in place to ensure that Centers for Independent Living are properly funded and trained to do the kind of work that needs to be done during this pandemic and future pandemics and other health emergencies that may arise.
Thank you so much. Okay, we're going to move on to our next speaker, and that is Marcy Roth from World Institute on Disabilities.
Good afternoon, everybody. I'm Marcy Roth. Pronouns are she and her. I'm an older white woman with COVID gray curly hair. I'm wearing a blue top and red glasses, and I am sitting in front of the logo of the World Institute on Disability, which includes a globe in purple and white. I want to thank April, and I want to thank the National Council on Disability and all who have been working together so very hard to share this incredibly important news. We've asked folks to come together, not simply to celebrate one victory, but in fact to teach people, or to begin the process of teaching people how to access the disaster resources that may be available to, for instance, independent living centers, in order to provide a variety of disaster-related emergency protective measures. And so I'm going to take a couple of minutes and explain about the FEMA Public Assistance Category B emergency protective measures to save disabled lives in disasters. And actually, Alyssa, could you allow me to share screen, please? Thank you. And I will okay, let me now go to the play from start. Okay, so again, we are focusing today on FEMA Public Assistance Category B Emergency Protective Measures. So I have to start by explaining the disaster declaration process, and it begins with an actual disaster or a threat of disaster, and then the impacted state identifying that their resources have been overwhelmed. Their governor requests federal assistance, and when approved, that is called a presidential declaration. Now, in this next slide, I want to show you what happens once there is a presidential declaration. That declaration could be a major disaster declaration or an emergency declaration. Today, we're going to primarily be talking about major disaster declarations. When there is a major disaster declaration, the state may receive public assistance, individual assistance, hazard mitigation. Today, we will only be talking about public assistance. And the Public Assistance Program, also known as PA, has a number of categories, but the only one of those categories that we're going to be talking about is emergency protective measures. And to help you to understand, the mission of FEMA's Public Assistance Program is to provide assistance to state, local, territorial, and tribal, they refer to them as SLTT governments, and certain types of private nonprofit organizations, they refer to those as PNPs, so that communities can quickly respond to and recover from major disasters or emergencies declared by the president. In this next slide, what I'm showing you is the FEMA Public Assistance Program and Policy Guide. It's a 266-page guide that goes into great depth about all of the rules and policies around public assistance. And I've also provided a link, and I'm sure that Alyssa will be happy to share this. So in this next slide, what I want to point out is that under the Emergency Protective Measures Category B, one of the priorities is to eliminate or lessen immediate threats to lives, public health, or safety. And the protective measures and costs that could be reimbursed include transporting and pre-positioning equipment and other resources for response, supplies and commodities, medical care and transport, evacuation and sheltering, use or lease of temporary generators for facilities that provide essential community services, dissemination of information to the public, providing warnings and guidance about health and safety hazards using various strategies such as flyers, public service announcements, or newspaper campaigns. I'm sharing this because although today we are specifically focusing on emergency relocation, I want folks to understand that that Category B, emergency protective measures, goes far beyond this piece that we're focusing on today. When they talk about private nonprofit essential social services, they have a fascinating list of who is considered to be an essential social service. They point out certain types of facilities, such as senior centers, are considered to provide essential social services to the general public. They also talk about facilities that do not provide medical care, but do provide daycare for individuals with disabilities or access and functional needs. For example, those with Alzheimer's disease, autism, muscular dystrophy. This is a direct quote from the guidance document that I just showed you. Residential services for individuals with disabilities, and sheltered workshops that create products using the skills of individuals with disabilities. They also talk about non-congregate sheltering. FEMA may reimburse costs related to emergency sheltering provided in non-congregate environments. And they note that the Assistant Administrator for Recovery has the authority to approve this policy exception allowing for non-congregate sheltering. In fact, FEMA has approved 100% cost reimbursement to states relocating people experiencing homelessness to non-congregate settings like hotels and motels for the period from January 2020 through November 30th of 2021. And that might be expanded further, we don't know. But really important to point out how valuable this program has been for people who experience homelessness, many of whom are people with disabilities. And when we first learned about this, we thought this is an obvious opportunity to as well relocate people in dangerous and in fact, so dangerous that hundreds of thousands of people with disabilities have died in congregate settings like nursing homes, jails and prisons, psychiatric hospitals, group homes, many other facilities. Let me point out that the impact of living in these congregate facilities is disproportionately borne by Black, Indigenous, people of color, and particularly most of them are people with disabilities. The U.S. Department of Health and Human Services, Centers for Disease Control and Prevention, provides direct assistance or enables direct assistance to state, local, tribal, and territorial governments in response to an infectious disease incident. FEMA may provide assistance for the rescue, evacuation, and movement of persons and supplies and care, shelter, and other essential needs of affected human populations. Any assistance provided by FEMA in response to an infectious disease incident is done in coordination with the CDC. FEMA intends that this non-congregate sheltering is available to meet the needs of communities where there is a demonstrated disaster-caused need for shelter, and that people who are sheltered are then transitioned to the next phase of recovery when there is no longer an immediate threat to life or public health and safety. Surely in institutions, we know that that immediate threat to life and health and safety still exists. So there are many services that can be provided that are to applicants who are eligible. And in the FEMA policy 104-009-18 version 3, it points out that this policy was first put in place June 1, extends through November of this year. And it is of the utmost importance that they are sheltered in a manner that provides a level of separation between individuals and households and does not increase the risk of exposure to or further transmission of COVID-19. It goes into details about how the reimbursement process occurs. And I look forward to further discussion about all of this and Misty Dion's incredible tenacity against very difficult circumstances to continue to press for the relocation of disabled people from dangerous settings on their journey to freedom. And we will now hear from Misty about how she made that possible and how this one victory throws open the doors, if we choose to pull people through them, opens the doors for many, many, many more people to survive this horrific set of circumstances. So thank you for the opportunity to talk a little bit about Category D.
Thanks, Marcy. That was fantastic.
Thank you.
And now I'm going to turn it over to Misty to tell us about her journey.
Thanks, Alyssa, and thank you, Marcy, and welcome. Thank you for having me. As Alyssa said, my name is Misty Dion, and I'm the CEO for Roads to Freedom Center for Independent Living. I go by she, her pronouns, and I am a middle-aged, fair-skinned woman with long hair and glasses in an artificial background that appears to be luxurious glass porch to the rolling hills. With that, thanks again for having me. And as Alyssa said, I will share a little bit about Roads to Freedom and my journey with trying to respond in the face of a disaster for individuals who are in congregate settings with disabilities. First, I want to share that Roads to Freedom Center for Independent Living, also known as the Center for Independent Living of North Central PA in Pennsylvania. We are located in Williamsport, and we receive federal funding from the Administration on Community Living to provide disability-related services in 9 counties in North Central Pennsylvania. We also have contracts with managed care organizations to provide nursing home transition to individuals in 36 counties. I say that to help you understand the large region that we serve, and as hopefully I will later share the approach that FEMA, the FEMA requires for emergency response is local to your county and really starts and ends in your county. Therefore, to respond to an emergency of large scale would mean working with 36 county emergency management agencies, which is an unrealistic expectation for our center and probably many others. Shortly after the pandemic started in April of 2020, we saw an approval from FEMA that approved funding for non-congregate sheltering for homelessness and first responders, as well as healthcare workers. With that, our team had sort of sat back and looked at our list of nursing home transition individuals that we had been working with and thought, what can we do to offer emergency response to these individuals? And would this approval cover also those dying locked in nursing facilities and long-term care facilities? We worked together to design an emergency relocation program that was much like nursing home transition, but as we refer to it as nursing home transition on steroids. We sent emails to the county and the state, imploring them to help support our emergency relocation program and to give the residents the option to move to a safe environment in a hotel or a dormitory where they would receive equivalent and actually more individualized care. In May 15th of 2020, we received a copy of a letter from FEMA to the FEMA director, Padfield, that stated in the Commonwealth, non-congregate sheltering was only approved for reimbursement for homeless populations, first responders, and healthcare workers, end quote. We continue to persevere and request additional conversations with FEMA and PEMA so that we could help understand, so that they could help us understand where that discriminatory blanket approval ended and where help for people dying in nursing facilities began. In June 23rd of 2020, we had a meeting with FEMA, PEMA, the Pennsylvania Department of Health, and the Pennsylvania Department of Human Services. During this meeting, FEMA had indicated that there were other regions that were eager to hear what advocates would come up with in PA and could be a lead in this forefront. Jeremy Fannin expressed his willingness to explore the possibility. The State Department of Health and Human Services began to discuss with us the ability to relocate individuals, but they had many questions on who was the payer, whether there was a need for a 25% match, and who needed to provide that match. In August of 2020, we started to make some headway. We had requests from the state to seek allocation from the Department of Health, PEMA, and FEMA for Category B funds. During the next few weeks, we received responses where FEMA was considering and hopeful that Category B funds would cover not just the homeless. Fast forward to October of 2020, we received information from like Herman and Shaylin with the partnership from the Partnership for Inclusive Disaster Strategies, and Marcy with the World Institute on Disabilities, that sort of outlined the process that Marcy just went over with you. We shared that with our local county commissioners and our emergency management agency. We began discussing with them the need to have a memorandum of understanding so that we could facilitate these relocations and apply for Category B funds with them. It was then that we were told that that is the responsibility of the facilities to relocate and provide emergency services for their residents. After much back and forth continues with the state, with our local county emergency management agency, and FEMA and PEMA, we began to outline a memorandum of understanding. During this time, we were told by PEMA and by our local county emergency management that our agency could not participate in FEMA programs because we were just an advocacy group and we were specifically excluded from the FEMA program. About a week later, we received a question from FEMA asking if we owned or operated a facility. After having showed licenses with the state that we have to provide many services for people with disabilities, including nursing home transition and attendant care services, we found out that we were not a private nonprofit eligible for direct reimbursement, like Marcy explained. Shortly or later that month, FEMA had a disability summit, and during the disability summit, there was discussions of this Category B funds covering or being eligible to cover individuals in the nursing facilities. We continued to push our local emergency management agency with an MOU, a memorandum of understanding, to start the initial process of requesting reimbursement. We provided relocation services in July and throughout the pandemic for a number of individuals to transition them, in some cases from a hospital into the hotel, so that we could avoid them having to have a placement in a nursing facility. Some of you may be aware of the 1135 waivers that expedited those type of placements and caused many more individuals to contract the COVID virus unnecessarily. In addition to diverting people from the nursing facility, we went through our consumers that we had been working with to offer them emergency relocation in a hotel. During this time, a few of the individuals moved into their hotels. We set up DME, durable medical equipment, attendant care services, skilled nursing, food, worked on continuing the transition to further help them get back to the community once the hotel stay was over, and their home was ready for return. During this time, a number of correspondence back and forth with the local emergency management agency and FEMA continued. We were successful at completing a memorandum of understanding and submitted all the paperwork. That was around February of 2021. Meanwhile, about a month later, as we followed up with the local emergency management agency to see where we were at, we found out that actually nothing had been submitted, and we needed to redo our invoices to make sure that the invoices were sent to the local county emergency management agency and not FEMA or FEMA like we had originally had them going to. So we changed that, and shortly after, we followed up once again to find out that they were still waiting to hear from FEMA. Actually, no, FEMA had said that during that time when we were asked to change the invoices, that we were approved and that we just needed to change the invoices. So we did that and sent it back in, only to find out that we had not been approved and it was still awaiting reimbursement. Later, about 2 months later, we were corresponding with the FEMA Department of, let me think, sorry. Oh, from the FEMA Department of, sorry, I lost my notes here. Oh, I guess I must have skipped that part. My apologies. So we were in touch.
Marcy. It was the FEMA regional office?
Thank you. Thank you. Thanks, Marcy. So we've talked with the FEMA regional office and a number of other departments during this time. So it sort of starts running together a year later. But thanks, Marcy. During that conversation, we understood that our application had not been submitted. So we followed back up with our emergency management agency, and the Partnership for Inclusive Disaster Strategies also followed up with another department within FEMA. It was at that time that we learned
Misty, this is Alyssa. If you can hear us, you have frozen. Okay, well, while we wait for Misty to reconnect, Marcy, do you want to fill in any gaps while we're waiting?
This is Marcy, and I think, you know, the takeaway is that this independent living center was extremely persistent. And while this was happening, lots of people who would have liked to have been relocated died. So I see that Misty is back, and we will turn back to Misty to pick up where she left off, or where she froze off.
I'm so sorry about that. My computer turned off with no warning. So where was I? Once we received the information from FEMA that our application had not been submitted, and the Partnership for Inclusive Disaster followed up with them, we received information that there was communication between the Emergency Management Agency and FEMA, and it sounded as though our Center for Independent Living was not willing to collaborate with our Emergency Management Agency. After, clarifying that inaccurate information, we provided the MOU and all of the follow-up and correspondence that we had throughout this time. And within about a month after that, we received confirmation that our reimbursement request was in fact submitted and obligated, as they use the term, to say that we were awarded the reimbursement. We've not received the reimbursement yet, but I share that sort of cyclical back and forth journey to explain that though this is a process that can be used, it's certainly not a process that can facilitate adequate response to a disaster, especially if you're covering a large region where you need to work with 36 counties. I will say that during this time, if it weren't for the expertise of allies and other disability-led organizations, I don't think we would have gotten here even now. It seems as there's much disconnect between our local emergency management agencies and providing services for people with disabilities. So with that, I will turn it over to Alyssa, and willing to answer any questions.
Thanks, Misty. Yeah, we are going to open it up for questions. I want to, part of our reason for having this call is to let folks know that this process takes a lot of tenacity, and it is a reimbursement process. And we understand that, there are some centers who simply don't have the budget to front this kind of money and then get reimbursement after the fact. So we really just want to be able to lay out the path honestly, clearly, so that everyone knows what it's going to take to do the work. And there will be follow-up to this call, that we can continue this dialogue. And as information comes into us, as we get more resources to disseminate, we will get that to you guys on the ground, because we are only as successful as the collective we. And we want to be able to provide you guys, to everybody, with the needed resource, toolkit, material, best practices to do the work. And so does anybody have any questions for any of the panelists? I'm seeing one come in from Kathy Powers. And her question is there a mechanism to report negligence or refusal to activate services? In this case, how many people died because they could not move?
This is Marcy. Would you like me to respond to that? So Kathy, really important question. And in fact, the only mechanism is one in which you can file a complaint based on what you believe to have been discriminatory activity. And when you file that complaint, it has to be after someone has actually been harmed. We have tried for a long time to shift the process by which advocates can raise concerns about what appears to be the inevitable failure to provide what is legally required of federal agencies, and then all of the grantees and subgrantees of those federal funds. But as it stands right now, and let me also point out, you may recall quite a bit of discussion this year about nursing homes were granted immunity from lawsuits. We were horrified that this was allowed in a number of states. There was even the possibility that this would be a federal allowance. But in fact, today, in a number of states, people no longer have those protections that disability rights laws should afford them.
Thanks, Marcy. And Kathy has a follow-up. Is there a database to follow the applications?
This is Marcy. There's no. And not only is there not a database to follow the applications, there's no record of people who are being institutionalized in disasters. So not even the effort to follow your application process, but we can't even keep track of people we care about.
And this is Misty, Alyssa. I'll add to that. I was early on in the process, I was given a survey link for which I was told to upload all of my expenses. It was my understanding at that time that the survey link was designated for those who were a private nonprofit directly requesting reimbursement from FEMA. I went through that just to go through it a number of times and never even had a confirmation that it was submitted. Absolutely no response from it. And that was early on before we started the MOU and learned that that was not the process. And I bring that up just to say at the very end, after we had the MOU, and my question was, okay, so now how do I submit this reimbursement request? I was directed back to the survey link. So what a cumbersome process, and with no sort of confirmation of where you're at in the process.
Thanks, Misty. This is Alyssa. We have another question from Jody Huffentagler. I am sorry if I just butchered your name. My apologies. I'm curious about how the hotels were about partnering.
So this is Misty, and I will take this question. We found the hotels during this time were very interested in partnering with us. In some cases, we had hotel owners who would also throw in the food if they had a restaurant on the premise, and would be willing to sort of help us with, clean up, laundry services, and some of those extra things to make it quite easy for us, because they didn't have a lot of customers during that time. As we all remember, travel was limited. And so to many of the hotel chains and partners that we worked with, they were very interested in working with us. And before FEMA made the took the 25% match piece from the application and decided that they would cover or reimburse the full 100%, some of the hotels were offering to also cover that match. So.
Thanks, Misty. And we have another question from Karen Mikowski-Carney. When your state has given MCOs the option to do nursing home transitions themselves or authorize CILs to do so, and the MCOs are not giving the CILs the option to do so, how can FEMA funds be utilized?
That's a great question. So as we all know, FEMA is a payer of last resort, much like our Medicaid state service fees or insurance. When the managed care organization is involved, it certainly takes a different spin. In Pennsylvania, MCOs are what's termed in the Medicaid waiver as an administrative waiver, which makes it a little bit more difficult to assure that choice is available for the residents. In this case, MCOs certainly slowed their transition processes down, not just in referrals, but also in working with the service coordination agencies to have, your care planning meetings and to coordinate the transition as we would pre-COVID. So, that it makes it a lot more tough for you to get through that process. But in terms of FEMA, if nobody's providing that service and if the person is not eligible for that service, then FEMA reimbursement would certainly be suitable for that. Now, if the MCO is the one supposed to be covering that, then they would still cover the services that are part of that transition. Now, a hotel stay isn't necessarily part of a nursing home transition. So that piece of it specifically would still be a FEMA reimbursable Category B request.
Thanks, Misty. And there is a request in the chat. Would love to hear from Marcy and Misty on their thoughts, on what a direct funding model would look like to centers for independent living instead of the current reimbursement model.
This is Marcy, and first and foremost, transition is a fifth core service for independent living centers. And so right out of the gate, there needs to be funding for transitioning people from dangerous places into the community. So that's number one. Number two, I have been saying this for many, many years. I believe there needs to be a sixth core service, and that needs to be emergency preparedness and disaster risk reduction. And part of the funding that should be applied to a sixth core service would be the kinds of funding that build capacity among independent living centers, the kind of funding that enables centers and other disability-led organizations to be able to do the kind of work in their local community so that the community is prepared for whatever the next big thing is. And there is, as we're focusing on climate, and as we're focusing on the extreme weather crises that we're dealing with, the amount of money that is invested during and after disasters, and the amount of money that is invested in preparedness before disasters is not making its way to those local experts who are the folks who support people to navigate individual disasters every day. So, I personally would love to continue this piece of that discussion. And Andreas, I'm quite sure I would be happy to continue that with you.
Thanks, Marcy. This is Alyssa. We have time to get to one more question from Anaya Robinson. Have you all shifted at all from the hotel model? We've started hitting roadblocks with all our hotel partners being consistently fully booked through the end of the year, and we're trying to find alternatives for non-congregate sheltering options for transitions.
That's a great question. This is Misty. We started to have difficulties. I mean, we've seen the uptick of, the hotels being booked. Around us, we had, so it's depending on if it's in the summer or if it's during college, there's dormitories and you have a couple other options like that. But that's a good question, and I'd be interested in hearing or working on some other ideas on that with you, Anaya.
And this is Marcy, and let me say, if we could get down to the business of working on accessible and affordable housing, the amount of money that the federal government spends on temporary housing in disasters is absolutely unbelievable. And if those funds could be instead invested in more permanent housing, tiny homes and accessible tiny homes and other kinds of housing that folks are talking a lot about, I think we have a huge opportunity to, rather than depend on, for example, hotels, figure out how we're going to improve the need for housing immediately following disasters and the rest of the time.
Thanks, Marcy. Okay, I'm going to turn it over to Herman Parodi quickly, and he's going to give us some resources for you guys, which will also be available after the fact.
Hola a todos. Thank you, Alyssa. My name is Herman Parodi. I use he, pronoun. I'm a Puerto Rican brown man sitting in my wheelchair. I have dark brown pulled back hair today. I'm wearing a navy blue white dotted shirt. I am in Philadelphia on Lenape land. Along Shaylin Susalas, I am the co-executive director of the Partnership for Inclusive Disaster Strategies. And thank you all who have come. All that has been discussed today, as you have heard, has come with the work of many years. But most recently last year, and I'll begin sharing some links on the chat. We thank the work and the collective environment that the National Council for Independent Living and the roundtable discussions allowed for the creation of the PAS addendum that led Misty through a lot of effort, be here where we are with a bridge, a path to emergency relocation. All to find your local independent living center, please find the link on the chat and there will be further for the Independent Living Research Utilization Directory, as well as for folks needing COVID information and vaccine for people with disability, to reach the dial line. That's 888-677-1199. That is available Mondays through Fridays from 9 a.m. Eastern to 8 p.m. Eastern time. Lastly, the partnership holds disability, COVID-19 and concurrent disasters calls. Please contact us at directors@disasterstrategies.org and visit us at this as well as disasterstrategies.org. And you will find more for advocacy and ongoing educative measures at REAADI, REAADI.com for needed ongoing advocacy that will help Centers for Independent Living reach and create inclusive disaster risk reduction and emergency management systems, as well as the DERMA, the Disaster Relief Medicaid Act, which will create a system for Medicaid follows the person in disasters. Much more, please visit our websites and the resource provided. Thank you all. Back to you, Alyssa.
Thank you so much, Herman. I really appreciate that. And all of these resources will be available. A recording and transcript of this webinar will be archived on the April website, as will the resources discussed today. For those of you who are registered for the April conference, there will be a workshop on this, and I'm going to throw everything in the chat. We will continue to hold these types of pertinent webinars to disseminate resources as they are identified and developed. And as always, please feel free to contact me directly with any follow-up questions or concerns. And I want to thank you all so much for taking time out of your day to be on this webinar. We value you and we appreciate the work that you do. And with that, I conclude the webinar. Thank you all so much. Thank you to our ASL interpreters and our CART transcriber. We appreciate you.